Will doctors become obsolete? When you step into the doctor's office, it may be an AI avatar on a monitor, instead of an actual person. Have you ever wondered how artificial intelligence is transforming the way we approach medical care? Today, we're diving into the realm of AI-powered innovations that are revolutionizing patient diagnosis, treatment, and healthcare accessibility. But first, let's spark your curiosity with some questions that we'll explore in this video. How is AI revolutionizing diagnostic accuracy and early disease detection? What are the key benefits of integrating AI into healthcare systems? What challenges and risks does AI face in the healthcare industry? Stay tuned as we unravel the exciting advancements and potential of AI in healthcare. Artificial intelligence in healthcare isn't science fiction. It's a reality reshaping how we analyze medical data and deliver patient care. From complex algorithms to machine learning and computer vision, AI technologies are powering a new era of medical innovation. Imagine AI algorithms scanning medical images like X-rays and MRIs with unparalleled accuracy, aiding in early disease detection and improving patient outcomes. These technologies are not used in isolation, but often work in tandem to create powerful healthcare solutions. For example, a system might use computer vision to analyze a medical image, machine learning to compare it with thousands of other cases, and natural language processing to generate a detailed report for the healthcare provider. As AI continues to evolve, we can expect to see more sophisticated applications that combine these technologies in novel ways to address complex healthcare challenges. Let's delve deeper into the types of AI technologies driving these innovations. Machine learning, a subset of AI, allows systems to learn and improve from experience without being explicitly programmed. In healthcare, it's used for predictive analytics, such as forecasting patient admission rates or identifying high-risk patients. Natural language processing, NLP, enables computers to understand, interpret, and generate human language. In healthcare, NLP is used to analyze clinical notes, medical literature, and patient records to extract valuable insights. Computer vision, another crucial AI technology, focuses on how computers gain high-level understanding from digital images or videos. This technology is particularly valuable in medical imaging, assisting in the detection and diagnosis of diseases from visual data. AI's prowess shines in diagnostic accuracy and personalized medicine. Machine learning algorithms can analyze vast amounts of patient data, including medical histories, genetic information, and lifestyle factors, to identify subtle patterns that might escape human observation. These AI-powered diagnostic tools not only improve the speed and accuracy of diagnoses, but also enable earlier detection of diseases, potentially saving countless lives through timely intervention. Imagine a scenario where AI algorithms analyze a patient's genetic markers, medical history, and environmental factors to predict their risk of developing cardiovascular disease years before symptoms manifest, allowing for targeted preventive measures. In the realm of personalized medicine, AI is playing a crucial role in tailoring treatment plans to individual patients. By analyzing a patient's genetic makeup, medical history, and lifestyle factors, AI algorithms can predict how a patient might respond to different treatments and suggest the most effective course of action. Moreover, AI is enhancing medical imaging interpretation by quickly analyzing complex scans and highlighting areas of concern for radiologists. For example, AI-powered tools can assist in identifying early signs of Alzheimer's disease from brain scans, enabling timely interventions and improved patient outcomes. Another significant use case of AI in healthcare is in predictive analytics. AI algorithms can analyze historical patient data to predict future outcomes, such as identifying patients at risk of developing chronic conditions or predicting hospital readmission. This proactive approach allows healthcare providers to intervene early, provide targeted interventions, and improve patient outcomes. Furthermore, AI is transforming the field of virtual health assistance and telemedicine, bridging geographical barriers and improving access to healthcare services, especially in rural or underserved areas. The integration of AI in healthcare offers numerous key benefits that are revolutionizing patient care and medical practices. One of the most significant advantages is the improvement in diagnostic accuracy and speed. AI algorithms can analyze vast amounts of medical data, including images, patient histories, and genetic information, to identify patterns and anomalies that might escape human observation. This enhanced diagnostic capability not only leads to earlier detection of diseases, but also enables more timely interventions, potentially saving countless lives through prompt and targeted treatments. AI is also playing a crucial role in reducing healthcare costs and improving operational efficiency. By automating administrative tasks, such as scheduling appointments, managing electronic health records, and processing insurance claims, AI significantly reduces the workload on healthcare staff and minimizes human errors. Moreover, AI-powered predictive analytics can help hospitals optimize resource allocation, reduce patient readmissions, and streamline supply chain management. For example, AI algorithms can predict patient admission rates, allowing hospitals to better manage staffing and bed capacity, leading to improved patient flow and reduced wait times. Perhaps one of the most promising aspects of AI in healthcare is its potential to increase access to quality care in remote or underserved areas. Telemedicine services powered by AI can provide remote consultations and diagnoses, making it easier for patients in rural or underserved regions to access specialized care without having to travel long distances. AI-powered chatbots and virtual health assistants can triage patients, provide basic health information, and even offer mental health support, extending the reach of healthcare services beyond traditional clinical settings. Furthermore, AI can assist in training healthcare workers in remote areas by providing up-to-date information and guidance, thereby improving the overall quality of care in these regions. As AI continues to evolve, we can expect to see even more innovative applications that bridge the healthcare access gap, ultimately leading to improved patient outcomes and more equitable healthcare delivery across diverse populations. The implementation of AI in healthcare faces several significant challenges, with change management being a primary hurdle. Healthcare professionals often resist adopting new technologies, as AI systems are held to higher standards than existing processes. This resistance can slow down the integration of AI into clinical practice. However, comprehensive training programs and educational initiatives are helping healthcare professionals understand the benefits of AI and navigate the transition effectively. Ensuring the privacy and security of patient data is paramount when implementing AI in healthcare. AI algorithms typically use anonymized and aggregated data to protect individual patient privacy. However, concerns remain about the potential for re-identification of patients through advanced data analysis techniques. To address these concerns, healthcare organizations are implementing robust data governance frameworks, encryption methods, and access controls. They are also working to comply with regulations such as HIPAA in the United States and GDPR in Europe, which set strict standards for handling patient data. Despite these measures, the challenge of balancing data accessibility for AI development with patient privacy remains an ongoing concern in the healthcare industry. Bias in AI systems is a significant risk that can lead to disparities in healthcare delivery and outcomes. AI algorithms may inadvertently perpetuate or exacerbate existing biases present in historical medical data, potentially leading to unfair or inaccurate diagnoses and treatment recommendations for certain patient groups. To mitigate these risks, researchers and developers are focusing on creating diverse and representative datasets, implementing fairness constraints in AI models, and conducting rigorous testing for bias. Additionally, there is a growing emphasis on transparency and explainability in AI systems, allowing healthcare providers to understand how AI arrives at its conclusions. Regulatory bodies are also developing guidelines to address AI bias in healthcare, although the rapidly evolving nature of AI technology presents ongoing challenges in this area. As AI continues to integrate into healthcare, maintaining the traditional doctor-patient relationship while leveraging the benefits of AI remains a delicate balance, requiring ongoing education and adaptation from both healthcare providers and patients. As we conclude our journey into AI in healthcare, we've explored its transformative applications, benefits, challenges, and the power of collaboration. The future of healthcare is undeniably intertwined with AI, promising improved patient outcomes, streamlined operations, and equitable access to quality care.